Hello, I'm Merrill Hodge. In 1994, I retired from the NFL after suffering 2 concussions in 5 weeks. As it turned out, I was cleared for action and got back on the field too early. Concussion awareness is a team effort from top to bottom. Coaches, medical staff, players, and parents should all know the signs and symptoms of football-related concussions. Too often, football players who have suffered concussions feel pressure to rush back onto the field before they've recovered. I remember that pressure, which is why I'm thrilled that USA Football has teamed up with the CDC to provide coaches with this concussion awareness video. It is our hope that you gain a greater understanding of concussion signs and symptoms. This video will provide a simple 4-step action plan to ensure the safety of your athlete. As a coach, it is your responsibility to communicate this information to your players, parents, and assistant coaches. Thank you for your time. You may notice a prevailing theme in the following video, and we think it's worth remembering. When in doubt, sit them out.
By pushing the limits of speed, strength, and endurance amidst the physical contact of American football, players are hard-pressed to avoid injury. Injuries pose a risk that football players accept as one of their many challenges. But there are unacceptable risks, especially when it comes to the human brain. When a football player continues to play with a concussion, that player runs the risk of having long-term problems. Playing with concussion-related symptoms can even be fatal. A concussion is a type of traumatic brain injury caused by a bump, blow, jolt to the head, or a fall or blow to the body that causes the head and brain to move quickly back and forth. Keep in mind that on the football field, a ding, getting your bell rung, or what may seem to be a mild bump or blow to the head can be serious. In the game of American football, there's contact on every play. Concussions can occur at any time. This makes recognizing a concussion a challenging proposition. How do coaches recognize concussion events? The answer? Be observant. Monitor players between plays, especially those that result in severe collisions. As players head to the sidelines or back to their huddles, look for the signs and symptoms, which we'll cover in a moment. How do healthcare professionals describe concussions?
In technical medical terms, a concussion is a complex pathophysiological event to the brain that's induced by trauma.
Dr. Stan Herring is co-director of the Seattle Sports Concussion Program and a member of USA Football's Football and Wellness Committee, serving as a leading expert in the diagnosis and management of sports concussions.
What do these terms mean? As they relate to concussion, the term complex means a complicated cascade of injury to brain cells and the blood supply of the brain. Pathophysiological, this is not a structural problem. It's a software problem, not a hardware problem. The brain looks normal on CAT scan or MRI, but it doesn't function normally.
Just as healthcare professionals may not be able to see a concussion on an MRI or CAT scan, coaches may not see an obvious injury. So as a coach, it is important to know how to recognize concussion symptoms and danger signs among your players. As a coach, you play a vital role in identifying concussions. Sam Remsden is an athletic trainer for the NFL's Seattle Seahawks. He works closely with coaches and players as they experience the rigors of practice and gameplay.
When it comes to identifying a concussed player, a coach is often the first person on the scene and the individual best qualified to recognize concussion signs and symptoms. Coaches know their players, they see them every day, so they're a key component in helping identify concussions.
Because coaches know their players best, they can recognize when something is off, even when the player doesn't know it or doesn't want to admit it.
The coaches have the trust and confidence of the players. Players listen to their coaches. This creates an opportunity to do the right thing, to do the safe thing.
To help recognize a concussion, you should watch for the following 2 things among your players: a forceful bump, blow, or jolt to the head or body that results in rapid movement of the head, and any change in the player's behavior, thinking, or physical functioning. There can be many signs and symptoms of a concussion. They vary depending on what part of the brain is involved. Most of the time, they're subtle. Only about 1 of every 10 players will lose consciousness. Coaches should make their judgment based on what the player feels. and what the coach or parent sees. Players may feel symptoms including headache, pressure in the head, nausea or vomiting, balance problems or dizziness, double or blurry vision, sensitivity to light or noise, sluggishness, haziness, fogginess or grogginess, concentration or memory problems, and confusion. Players may also indicate symptoms vocally by saying that they don't feel right or they're feeling down. A coach or parent may see signs such as the player appears dazed or stunned, is confused about assignment or position, forgets an instruction, is unsure of game, score, or opponent, moves clumsily, answers questions slowly, loses brief or prolonged consciousness, shows mood, behavior, or personality changes, can't recall events prior to a hit or fall, or can't recall events after a hit or fall. Signs and symptoms of concussion generally show up soon after the injury, but the full effect of the injury may not be noticeable at first.
For example, in the first few minutes, the player might be slightly confused or appear a little dazed, but an hour later, they can't recall even coming to the stadium. So assess the player, then assess them again, and then reassess the player later. Make sure that the player is supervised for at least 1 to 2 hours after you suspect a concussion. If a football coach suspects a player has suffered a concussion, it is critical that that player not return to play or practice.
What would I say to a young football player who has suffered a concussion? I'd say, okay, I think you've got a concussion, and it's not too bad. I'm going to sit you down on the sidelines for a little bit, and we're going to keep an eye on you. You need to rest, and we need to talk to your parents about what's going on.
Players who experience one or more concussion signs or symptoms should be kept out of play until a healthcare professional experienced in the diagnosis and management of concussions says they can return to play. If you suspect that a player has a concussion, follow these 4 steps. Remove the player from play. Look for signs and symptoms of a concussion if your player has experienced a bump or blow to the head or body. When in doubt, sit them out. Ensure that the player is evaluated by an appropriate healthcare professional. Do not try to judge the severity of the injury yourself. Healthcare professionals have a number of methods that they can use to assess the severity of concussions. Inform the player's parents or guardians about the possible concussion and give them all the pertinent information at your disposal. Make sure they know that the player should be seen by a healthcare professional experienced in the diagnosis and management of concussions. It bears repeating. Keep the player out of play until an appropriate healthcare professional says they are symptom-free and it's okay to return to action.
You have to stop football participation until the signs and symptoms of a concussion resolve.
When in doubt, sit them out. As a coach, sometimes you're going to have pressure from parents to return a younger player quickly. What you have to understand is that young players are different than adult players and that their concussions will take longer to heal.
During practice or during a game, a coach decides to remove a player with a suspected or demonstrated concussion. After that is done, the decision about return to practice or play is a medical decision. No longer is a coach required to be a coach and a healthcare provider. No longer is a coach put in a position where he or she has to bend to the pressure of a player or perhaps an overbearing parent.
Part of the problem is that players may hesitate to report symptoms. They may believe their injuries are no big deal, or they'll try to tough it out and return to the game for their team. There may be pressure from parents, other adults, or other players to keep playing. Don't let your athlete convince you that they're just fine or that they can tough it out. Emphasize to athletes and parents that playing with a concussion is dangerous.
If a coach suspects a concussion in a young football player, it is critical that that player not return to play or practice.
A concussed football player who returns to play too soon or plays through the concussion does so with their brain in a state of vulnerability.
If one of your players has a concussion, their brain needs time to heal. A repeat concussion, one that occurs in a short time period before the brain recovers from the first, can be very dangerous as it may slow recovery or increase the chances of long-term problems. It can even be fatal. Most people who suffer a concussion fully recover. However, returning to sports and other regular activities too quickly can add weeks or months to an individual's recovery time.
Everybody recovers differently from a concussion. Symptoms can last an hour, a day, 2 weeks. A more serious concussion could last for months or longer.
For boys and girls who are in school, concussions not only affect sports performance, they can affect school performance as well. Students may find they can't do their homework, they can't concentrate or study because it prolongs their symptoms, just like a premature return to sports.
Exercising or activities that involve concentration, such as studying, working on the computer, and playing video games, may cause concussion symptoms, such as headache or tiredness, to reappear or get worse. After a concussion, physical and cognitive activities such as studying and learning should be carefully managed and monitored by a healthcare professional. Insist that safety comes first. No one technique or piece of safety equipment is 100% effective in preventing concussions. But there are things you can do to help minimize the risks of concussion and other injuries. For example, to help prevent injuries, make sure that players wear properly fitted helmets and protective equipment. Wear well-maintained helmets consistently and correctly. This includes having the chin strap buckled at all times. Understand that helmets can help protect their head and brain, but they are not 100% effective in preventing concussions. Follow the rules of play and practice good sportsmanship and self-control at all times. Use proper football fundamentals when blocking and tackling. Practice heads-up football. A player should never lower his head during a hit. And remember, when in doubt, sit them out.
Thank you for watching USA Football's concussion awareness video. For more information and safety resources, visit cdc.gov/concussion or usafootball.com.